speak about. I thought it might be of interest to you. It's about fluorbiprofen lozenge. It's an independent study that we conducted for a sponsor that is applying for registration in the United States. And this was done under double-blind conditions. No one at the center knew what the products were, active or placebo. It was randomized, meaning that patients randomly received either the active lozenge containing fluorbiprofen or a placebo lozenge containing the sugar mentholated base. And over 24 hours, we evaluated their sore throat pain, their difficulty swallowing, and also, which is also very common to patients with pharyngitis, a sense of how swollen the throat is, the inflammation that people get when they get a sore throat. So this poster summarizes it, but I can give you some of the highlights, and if you want, you can look at the details later. We had several different centers where patients came in because they had a sore throat of short duration, 1 or 2 days. They were all adults, and we evaluated them in the office for 2 hours, and then they evaluated themselves over the remaining 24 hours, and they could take the lozenge as needed over 24 hours. And some of them got the active drug, fluorbiprofen lozenge, and some of them got the placebo. All of them had physical evidence of pharyngitis, and by that I meant that the doctor examined them and rated each of the findings: tonsils, the size of the tonsils, the color of the throat, adenitis, oral temperature, all of the classic features that a physician or any clinician would look for in a patient who presents with a pharyngitis. Well, I don't want to belabor it, but we measured these 3 patient-reported outcomes: sore throat pain, swollen throat, and difficulty swallowing at intervals over 24 hours. And the results show that there's a 45 to 60% greater effect of the fluorbiprofen lozenge compared to the base. So it's a true pharmacologic action. The duration of action of each use was well over 4 hours, in many instances 5 hours. And then, of course, patients took the next lozenge when they needed it. In over 24 hours, they got this dramatic and statistically important effect. What's the benefit to the patient? The benefit to the patient is, yes, they get relief, but it's not like they're just taking a sugar cough drop, for example, or a candy that will work, provides soothing or demulcent effects, but it wears off after 15 or maybe 20 minutes. Because of the fluorbiprofen, in a very low dose, the effect lasted 4 or 6 hours. So they didn't have to take lots of candy, if you will, and they got a real drug, a medication effect as well. There's another benefit too, and this is really beyond the individual patient, but it's a public health benefit, and that is that to the physician who doesn't know if it's a strep throat or not, he or she can prescribe this product, which is what will be applied for at the FDA. The doctor can prescribe it, waiting for the culture results. And if the culture results come out back positive, then they can add an antibiotic. But in many cases, the doctor doesn't know at the initial visit whether it's a strep or not. Yes, there are rapid strep tests, but in 20% or so of the cases, they are falsely negative or falsely positive, depending on how you look at it. So they're not 100% accurate. And the culture is really the gold standard that most doctors would use. And most doctors know that most cases of pharyngitis, well over 90% in adults, are viral. So 90% of the sore throats don't require an antibiotic. The advantage, therefore, is if you can prescribe a medication for the patient, like this one, provides relief, if it's viral, it's going to go away by itself, and there's no need for an antibiotic, which itself can have side effects. So that's the public health benefit, and that's not the reason we did this study. We did this study to see if it works, and it clearly does, and in a very dramatic way. And then I think, from my point of view as a researcher, there's another benefit. The first is the drug works, of course. The second is the public health. The third is we showed that it's not just the pain of a sore throat that's relieved, but the function of the throat was also improved. And they'll show you later, if you look at the curves here, different figures, you'll see that difficulty swallowing is a very bothersome symptom to patients with a sore throat. And it was improved, and it shows right here, in fact, that this is how swollen the throat is reduced by 44% compared to the placebo. And if you look at difficulty swallowing, which is I was just talking about, you can see that there's also a 45% improvement compared to placebo. That's a real dramatic effect. And what does it mean to the patient? It means that function is improved, and the sensation of a swollen throat is also improved. Up above, and I gather you're looking at it now, you'll see that here's where we talk about the pain of a sore throat, but the other two are other qualitative features that are very meaningful to patients with sore throat too. So I thought that the study was quote positive, but I know that for patients in the study itself, the product was very helpful. And if there are any other questions, you can ask me.